I've started recording. Sorry about that, everybody. So with that, good afternoon. Hello, everyone. I would like to welcome you to the Urban Indian Health Institute's Community Grants Program pre-application webinar. And this will be for fiscal year 2020 through 2021. So a little bit of our agenda for the day, we will again do a welcome. We will introduce you to the key staff here at the Urban Indian Health Institute. We will go over a overview of the Community Grants Program and its purpose and its objective and what we are trying to do with it, what funding opportunities we have for this fiscal year, application logistics, also looking at critical dates and technical assistance, and we will also have time at the end for any final questions. With that, again, I just want to welcome everybody. Again, thank you so much for being here. This is very exciting to be able to continue the Community Grants Program here at the Urban Indian Health Institute to help support urban Indian organizations and urban Indian health programs. Before we start, excuse me, before we start any meeting or webinar, here at the Urban Indian Health Institute, we always like to begin in a good way. And these usually can take multiple forms, whether it is a icebreaker, or it is a prayer, a song, or a story. It could be a multitude of things. But really what I want to talk about is really just highlighting the amount of resiliency that our people have been showing over the course of the last year, in response to COVID, in response to just everything that has been going on. I really just want to commend all of the urban Indian programs that we work with through our community grants program this year, plus also all of our partners, all of us throughout the network. I just really want to commend everybody for all of just showing the amount of resiliency that, that we Native people are adaptable, that we are flexible, that we are able to adapt to our climate, see what's going on around us, and being able to still make change and make efforts, and being able to, cause some change within our own communities, given all of the obstacles against us, even throughout history, is that we are still resilient and we continue to be resilient to this day. And I just want to commend everybody and just give a big old round of applause to everybody. And I'm hoping that everybody's safe and well, and that everybody's being able to thrive in some way, form, or fashion. But I just hope that everybody's doing well. And again, I just want to say thank you all so much for being on this call today. And we're happy to be here with you. So first, for introductions, I would like to introduce you to our management team. This team will be your main sources of contact for our funding opportunities this year. So first, I'll introduce myself. My name is Thomas Lawrence. I'm an enrolled member of the Makah tribe out of Neah Bay, Washington, and I am a program manager 2 here at the Urban Indian Health Institute. And my counterpart, unfortunately, she's not able to be here today. Her name is Christina Sun. She is also a program manager 2, and she is a Kanaka Maori. And she has been with us for a little under a year now, but she comes with great experience, great knowledge, and also offers a really great perspective coming from Hawaii and working with the Urban Indian Health Institute. Jessica, if you're able, do you want to introduce yourself really quick?
Sure, yeah. Hi, my name is Jessica McGee. I'm Blackfeet, so I'm originally from Montana. I'm a project associate 2 here at UIHI, and I've been here for a little over a year and a half. And I work under Christina for our branch program.
Yes, and that's also another thing I never mentioned, is that I've actually been with UIHI for 3 years. I almost completely forget that every time. And then in addition to our great project associates, we also have Mikaela Sakurai, who will be rejoining our team this year. She has taken some time off for maternity leave, and she's getting ready to come back with us and working with us, and we're so excited to have her back. She is Navajo and Palawan. She's been with us for, I believe, about going on a little, well, actually, we just had her annual year. So yeah, she's been with us for officially a year, which we are very excited to have, and we're excited to have her back and being able to help us improve upon our community grants program. Next, I would like to introduce our evaluation team. I know everybody has competing schedules and some were not able to join us, But I do see Martel has been able to join us. Martel, do you want to introduce yourself before I introduce everybody else?
Sure. Hi, everyone. My name is Martel Hesketh. I am Michelle First Nation, which is Plains Cree and Mohawk from Treaty 6 territory in Canada, but I grew up in Washington State, and I am an Evaluator 1 with UIHI. I've been an Evaluator 1 since about May, but have been working at UIHI in various capacities for like a little over a year now. Yeah, and I'm excited to work with all the grantees throughout this next year.
Thank you, Martel. As a lot of you can see, some of you have known of UIHI for quite some time and have gotten to meet with our evaluation team. As you can see, our evaluation team has definitely increased over the course of a year now, or a little couple years. So unfortunately, she's not able to be with us today, but our Director of Evaluation and Research, Dr. Rose James, she is Lemmy and Duwamish. She helps oversee all of our evaluation efforts here at the Seattle Indian Health Board, as well as the Urban Indian Health Institute. Then next we have Sophia Locklear, who is our evaluator 2, one of our longest standing evaluator here at UIHI. She is she is from the Lumbee tribe of North Carolina, and she helps oversee and manage and mentor our amazing evaluation team. Then next we have Daisha Gunther. She's also an evaluator 1. She's UPIC, and she's great. She's amazing. I mean, I can go on all day about our evaluation team, but I don't want to do that too much. And then last but not least, we also have Hannah, who is also a recent new addition to UIHI's evaluation team, and she is also an evaluator 1. So you will be, through, if awarded our funding through our community grants program, you will see all of our evaluators in different capacities. We will all be working with you in different ways. And so we just wanted to make sure that everybody got to see, or at least hear some names of the evaluation team that you could possibly be working with in the near future. So let's jump right into it. Let's go over what the community grants program is. So the purpose of the community grants program overall is to address chronic disease within urban American and Alaskan Native populations throughout the US. And what our goal is to work with these organizations to decolonize data for Indigenous people by Indigenous people. And really what does that look like is really taking what our funders are asking of us and producing data that is both meaningful as well as useful for our communities, and also just to add to the database of what American and Alaskan Native people are able to do and what we are able to do in these various capacities. And then what our objective is through our community grants program is that we really want to encourage the use of American and Alaskan Native traditional, cultural, and regional knowledge. And we really want to see that in the development and the implementation of chronic disease programs, chronic disease prevention programs. And this can take variations through education, management initiatives, and really any way of how your organizations decide they want to address chronic disease throughout your organization, throughout your communities. Because at the end of the day, we know that your communities have the solutions and have the answers to addressing chronic disease. And so we really want to highlight the knowledge that all of our communities have and how precious and how useful it is within the data set, and also ensuring that urban American Indian and Alaska Native populations that we're being counted and that we are being seen within the data sets. And so we just really want to ensure that we highlight those and that we really work with our organization, with our partner organizations, our grantees, to flourish and to be able to build sustainable programs and be able to build, at the end of the day, build amazing programs. For me and my 3 years of being with UIHI, it has definitely been a very immense pleasure reading through all of our community grants program evaluation stories, all of the evaluation data. It's very exciting, as well as also humbling to see what our people are able to do, especially depending on how much money we are provided, depending upon how much flexibility we have, that we're still able to produce amazing programs. And that's really what our objective is just to really showcase the amazing work that you do. And just to kind of give you a little bit more background, from my understanding, if I remember correctly, when I first started here 3 years ago, I believe we were just starting the community grants program. So I believe the community grants program has been up and running for probably about 4, maybe 5 years, if I'm correct. Don't quote me on that. But UIHI really wants to continue to collaborate with urban American and Alaskan Native populations and really reclaiming the values of data evaluation and research. And we really want to, strengthen public health capacity, address health disparities, as well as promote health resilience in urban Indian communities. Now, before I go forward, are there any questions? Any clarifying questions before I move forward? Okay. So I would like to introduce to you our funding opportunities. We have our SAGE grants, and we also have our Sweetgrass grants. Now, this is very different from what the Urban Indian Health Institute has done in the past for our community grants programs. But we really, because our community grants program is expanding and it's building, that we have decided to kind of do a little bit of a revamp on our community grants program. You'll see this within our website, on UIHI's website. You'll see that there's a difference. But really, we wanted to just try to find a creative way to get people excited about these funding opportunities. So for this year, for 2020, 2021, our annual focus for both our SAGE and Sweetgrass grants will be focusing on chronic respiratory diseases. Now, this will look different for both of our funding sources, for both SAGE and Sweetgrass. So for SAGE, the granting period will be from December 1st, 2020 through September 29th, 2021. Now for this grant cycle, for our SAGE grants, we will be focusing on Indigenous approaches to commercial tobacco use and cessation. And applicants may receive up to $95,000. If all applicants that UIHI chooses for our SAGE grants, and all of them choose the maximum amount of funding, we can release up to about 6 SAGE grants. This could take variations in forms if people decide not to take the full amount, but there is that option. And then for Sweetgrass, it will follow the same granting period, which will be December 1st, 2020 through September 29th, 2021. Now for Sweetgrass, their annual focus will be expanding projects related to asthma prevention, management, and survivorship. Now, for their awards, they will be awarding up to $10,000, and there will be exactly 4 Sweetgrass grants awarded. And and before I even move forward, are there any questions on the 2 funding sources, SAGE and Sweetgrass? Feel free to make a note in the chat or feel free to unmute yourself. Okay, so there is one in the chat. Let me see. We will be getting, I will talk about what restrictions will be needed on the funding. So we will get to that really, really quick. So I will be able to answer that here in just a moment. So hold tight. So who is eligible to apply for this funding? So this is also stated on our website. So applicants, organizations must be one of the following. They must be an urban Indian organization under Title V, as defined by the IHS, a member of the National Urban Indian Family Coalition, an urban Indian organization or program that has received SASP DVP funding, which is also formerly known as MSPI DVPI funding, as defined by the IHS. And also, like I said, we are expanding our community grants program. We wanted to also add in a new little bullet point for eligibility, is that a not-for-profit urban Indian organization whose leadership and board are made up of a majority of urban Indians and whose mission is to provide public health services to urban Indians may be eligible to apply on a case-by-case basis for this funding, which is great. We wanted to expand it a bit more. We also understand that there are different organizations that can fall under this funding, but we also want to make sure that we are not excluding any other urban Indian organizations through this application process. As for funding restrictions will remain the same year to year for both Sweetgrass and Sage grants, excuse me. And so recipients may not use funding for research, for clinical care, nor to purchase furniture, equipment, or clinical patient supplies. But recipients may use funds only for reasonable project purposes, including personnel, travel, supplies, and services, and salaries, if requested, are restricted to project activities only. Just to clarify that, what that means is that any FTE, any salaries are going to be used on this funding strictly have to be used for this project. It cannot be used outside the project unless otherwise approved by the Urban Indian Health Institute, which will be a case-by-case basis, which is very rare, but we want to ensure that all the money that is being put into these organizations, that they're being strictly focused on this project. Now, before I move forward, are there any questions on eligibility or funding restrictions? Can we apply indirect costs? So I believe that is also stated in our budget form regarding indirect costs. They are allowed as long as they are supported. But yes, indirect costs are allowed. Any other questions regarding eligibility, funding, or anything that I have said thus far? Okay, so we'll move forward. So how the selection process will go. So as you know, we have released the request for applications, both in our our bi-weekly resource email announcement that goes out, as well as in our website, as well as we've also notified all of our partners. And we've sent it out to our listserv. And so we're hoping for applications. So what will end up happening, the management team will put together a total of 2 committees, one for Sage, one for Sweetgrass, and we will review our applications separately. Now, all selections will be made using a group consensus-based decision-making. Once we have been able to identify who we would like to fund, because both Sweetgrass and Sage funding are supported by the Centers for Disease Control, we have to send our selections to our funders at the CDC to receive written approval. Now, this process can take time. This could take from 2 weeks. This could take to 2 months, to a month or two, depending upon what is happening. So hopefully, fingers crossed, it won't take very long. Hopefully, it just takes a couple weeks. We're going to be on a contracted timeline here at UIHI, but we're going to work very, very hard to try to make sure that we get out our decisions either by the end of December to the beginning of January. Now, what this means, like I said, because we sent out the request for applications already, that we would already have applications come December. So that's why we would be able to fund from December 1st of 2020 through September 29th, 2021. So and any changes to those timelines may vary, but that'll be at a later time. So big date that you all need to know if you are applying for this funding is that applications are due Monday, November 30th, 2020. Now, I do understand that this is definitely around holiday time, but it also, we wanted to get this out as soon as possible so that we could try to get our sub-grantees awarded as soon as possible. As we know, if you're applying for $95,000, that is a lot to try to spend down within a matter of about 8 to 9 months. And so we just really want to make sure that you have ample time and ample support to be able to spend down your funding. And your applications will be submitted to Jessica McGee, who is also on the call. She will be assisting me in tracking all of the applications for each grant, as well as helping me just get a good idea of how many people apply and for reporting. But all of your submissions will go to Jessica, and all of your submission information is incorporated in the RFA packet on the UIHI website, which states more clearly and more in detail of how to submit your applications. For any technical assistance that you may need on your application in regards to SAGE grants, you can reach out to myself, Thomas Lawrence. I am more than happy to assist you on any questions you may have during the application process. And for any technical assistance in regards to Sweetgrass grants, please direct those to Jessica McGee. I will work with her to assist in any technical assistance as needed. Any questions before I move forward? Okay, well, I mean, that's pretty much everything I have. So right now, now the floor is all of yours. Do any of you have any outlasting questions or big questions that you want to ask us? So I see Linda has a question regarding if you have funds from our previous funding, GWIC funding from the parent organization, from other sources, can you apply for UAHI SAGE funding? Linda, can you specify what you mean? Do you mean if you're already funded through GWIC, like a recipient of the original funding? Excuse me. Okay, so GWIC funds are given out by other techs. To be honest, I am not actually too clear on that. So I will actually get back to you on that. Jessica, can you make a note of Linda's question and I'll follow up with our funders, please?
Yes, I'll make a note of that.
Thank you. I just want to make sure that I get a good confirmed answer on that because we want to ensure that there's not a duplication of efforts and we don't want that to get flagged by the CDC. So we'll make sure that is clear. Any other questions? Feel free to speak out, feel free to put them in the chat or put them in the question and answer box. So the other question is, this is limited to Indigenous approaches to treatment and prevention only. How do we learn what those are? So we do not do, under these funds, we do not offer treatment, but we do focus on prevention. So, this is limited to approaches. And then can you clarify what you mean by how do we learn what those are? Can you clarify? And I also see your question, Linda, are you requiring evidence-based interventions? We would like evidence-based interventions, but we also understand that those aren't always compatible with our communities. So, I mean, our funders do like evidence-based interventions, but I mean, as long as you're able to prove how the effectiveness of your program. Hold on, excuse me. Is there an emphasis on evidence-based interventions, or can this be expanded to promising practice or promising tribal practice? Yes, yes. Though your evidence-based interventions can be expanded to promising practices or promising tribal practice. We want to highlight your community's tribal traditions and cultural backgrounds, that we want to ensure that those are present, that your community is able to address chronic disease. And we really, really love when people take an indigenous approach to these kind of programs. So the clarification to the last question was, what are indigenous approaches that are different from mainstream? Or is that the part of the grant that we would develop those? So this could go two ways. If your community already has an indigenous approach that you have identified that is useful, or that has been used before in your organization, in your community, those would definitely be great to highlight. But also this funding can be used to develop new projects and new approaches through your own community. So by all means, this money can be used to, really highlight the work that you're doing and really just utilize your background to address chronic disease. Okay. Any other questions? And also let me know if you are still confused or if you are not sure. I know that sometimes this can be a little bit confusing or a little bit mystifying, so please feel free to ask questions. Also, if I miss any questions or you're still confused, please let me know. Any additional questions? Anything? So the question is, can we use the money to address the underlying or upstream causes of commercial tobacco use in addition to EBI, such as creation of a teen space for them to gather and prevent smoking? Yes, I believe that could definitely be an approach to as long as there is a direct correlation to smoking, I think is really the biggest part for the SAGE grants. I mean, for any of the funding, the funding can be used to address underlying or upstream causes of commercial tobacco use, which can help to address those as long as those are made very, very clear. But yes, they can help be used to help create, whether it is an after school program that does tobacco cessation and smoking prevention, or just provides education. There's multitudes of ways that this funding can be used. Let's see, there's more questions. Hi, Colette. Thank you for actually bringing this up. This is actually very helpful. As you you asked, grants are due by the end of the day, November 30th, 21st. Which time zone? Thank you for actually making that very, very clear for us, because we realized that we did not make that very, very clear. So we will actually get back to you on what time these applications are due, because I do know that that is very critical. So thank you. Jessica, can you make a note of that we need to include a time, please? And we'll update everybody.
Yes, will do.
Thank you, Colette. Any other questions? Any comments or concerns? Okay, so we'll go ahead and move forward. So, oh, there is actually more questions. Never mind, hold on. Can we run project concepts by you? Yes. If you have ideas for your application that you want to run through UIHI, please definitely send those in for applications related to stage grants. Please send those inquiries to me. For again, that's for stage grants. Send those questions to me. For any questions regarding Sweetgrass, please send those to Jessica, and I will coordinate with Jessica, and we will work on discussing and just also just assisting in helping develop these concepts and project concepts for you all. We're here to help you identify those things, as well as just help you just find ways to have a competitive application. Plus, we also want you all to make this very, very hard on us. We always enjoy reading everybody's proposals. We love reading what you all are doing and reading about what you all have done. So please make our job harder when you're developing your applications. Any other questions? Always want to make sure we offer as much time as possible for questions if anybody has any. So we'll go ahead and keep moving forward. So if you do end up having any more questions regarding the community grants program funding for this fiscal year, feel free to reach out to myself, Thomas Lawrence at uihi.org, or also feel free to reach out to Jessica. We will be working very, very closely with each other to ensure that everybody reads the correct information, ensuring that everybody is able to develop an amazing application, and as well as just running your ideas through us. We would love to help you develop your ideas. And so, yeah, send your questions in. I hope that everything goes well for you all. And for any general information that you want to look at, please go to www.uihi.org. You can look at our community grants program profile up on our website. It will have the general information of our community grants program, and we'll go into both Sage and Sweetgrass grants more in depth and detail in their respective files. Let me check. Oh, cool. And if there are, again, any questions, feel free to reach out. We're here for you. If you have any clarifications on the funding or clarifications on any of the wording or what we are focusing on for these sources of funding, please let us know. We would love to make those clarifications for you. With that, I just really would love to say thank you. Thank you so much. We appreciate you all for attending this webinar with us today and for being so resilient and being able to try to get this work done and being willing to try to find new ways and approaches to preventing chronic disease. And I just want to thank you all, and I just really want to commend you all for all the work that you are doing and continue to do. And also just through the political climate and through the pandemic, I just hope everybody just remains safe, remains well, both mentally and just full body wellness. That's all I'm asking. But with that, I just want to say thank you guys so much. And if you have any questions, feel free to reach out. We will be, as you know, we have recorded this webinar. We will also make a digital copy of this webinar available on our website. And we just, want to send you off in a really, really good way and just thank you so much. And you all have a great day.